Hello and welcome to Sheila Lives Out Loud. I hope you've been well. I hope you're staying safe and keeping safe as well. Thank you for joining me on my channel. As always, please click subscribe and hit notifications so you don't miss an episode. And we continue with sharing information about COVID and our current situation in Kenya. And joining me for a chat and a checkup session is Dr. Simon Kigondu, my very good friend and the Secretary General of the Kenya Medics Association. Hey, Daktari, how are you doing?
I'm good, Sheila. How are you?
I'm excellent. Last time I spoke to you, you had just had the COVID vaccine and you look like you're in good spirits and good health.
Yes. With science catching up, we are hoping that the COVID vaccine will help in at least normalizing, so to speak, some of the things we previously took as straightforward, but what COVID has actually done has shown that maybe the vaccine can help us get a bit more liberated. We have seen the campaigns in the USA where they are aiming to vaccinate as many people as possible so that they can prevent COVID severe disease and try to almost normalize the situation as it is. I'm hoping that that is the situation that will also push the Kenya government to strive to.
Okay. Speaking about the vaccine, it's just also a health check on you to make sure you're doing good, what your experiences have been, because a lot of people have had access to the chanjo and everyone is experiencing very different symptoms. So what sort of symptoms did you face? How long did they last and how are you feeling?
A lot of symptoms are documented. So we must distinguish between what are called side effects, which are expected. These are as a result of the body doing what it is supposed to be doing. That is making antibodies against the coronavirus or a specific part of the coronavirus. So with that is related to the injection. The injection, you may get a bit of pain on injection, of course. And you may also get maybe a swelling or a bit of irritation on the site where the injection was done. So that is expected and is expected to resolve after a few days. Then you may now start experiencing some effects with the body creating antibodies against it. So you may get what are called constitutional features, constitutional symptoms. These may include fever, because it's a body reacting to something. So you get fever, you may get muscle pains, you may get a bit of, you may also get some feeling like as if you have a flu, sniffles and all. And you may also feel a bit of fatigue. And these are what are called known side effects of not only the COVID vaccine, but also other vaccines. And they are generally response of the body towards the vaccination and antibodies. Then, of course, this being, as we know, the COVID vaccines were authorized for emergency use. That means they were almost at what is called in the development of vaccines, the third phase, so phase 3, so to speak. So we are, as you have seen in the press and everywhere else, they are documenting what are called severe adverse reactions. So for instance, if, for instance, at any part, and we have seen this a lot in Europe and a lot of European countries, if someone, for instance, gets a vaccine and maybe passes on after 1 or 2 days, then the authorities must attempt to do some scientific research to see if this particular death was related to the vaccine. And so you may have heard in the news 1 or 2 things about pausing vaccination to investigate and what is coming out in terms of what they're trying to get a relationship with, and this science still ongoing, is the clots. They were saying there may be a relationship with one or two clots, and that is ongoing. Generally, what the message that has come across is that the dangers or the benefits of the vaccine outweigh the non-benefits. So the vaccination program, at least in Kenya, is continuing, and in some of the other areas, they have issued they have in some countries they have revised the recommendations of who should get the particular vaccines, and that is and so this is an ongoing thing. So I suspect we'll be having these interviews forever, because things keep changing and updating you.
Which is good, and that's why we touch base ever so often, because it's good to stay abreast with what's happening with the new knowledge, because again, like you said, it's a new situation, it's a new normal, and we're all just doing our best to adjust and stay informed, so we make the right choices. We are back to yet another lockdown as Kenyans, and mood on the ground is one of serious frustration. I'd be lying if I didn't mention the frustration that a lot of Kenyans are feeling right now. What is the intended outcome? Because the general thinking is, for most part, most Kenyans have behaved, you've tried your best, you've done well, but then there were some super spreader events that were, not initiated by the Mtu on the ground, but now we have to pay for those sins, for those super spreader events. Looking at this current lockdown, what does it serve? Knowing full well that this week there's going to be mass exodus of students from schools to different counties. Are we just trying to chase after the horse and it's already bolted?
So again, I think we need to look in perspective of what public health measures are meant to do. And we occasionally urge to avoid mixing up issues. And of course, a lot of people would come from a point of view of loss of income, loss of ability to actually take care of their families. And that actually needs to be addressed as actually a major issue. For instance, what have they done in the Americas? They realize that when they have done a stimulus package, whereby the most vulnerable are actually supported, and those who are, and in Kenya, actually, a majority of the people are actually vulnerable, so to speaking. A lot of people who may look well off, but actually the impact of of COVID and the restrictions has dealt a big blow to a lot of businesses, a lot of what people do. So we must look at that separately, and we must ask our government, what are you doing to mitigate this? But on the flip side, you must also look at the effect of spread of COVID-19. Just this morning, we have lost a doctor from a doctor in who is faculty in a university that teaches medicine. And before he had even died, his mother had died of COVID-19. So he didn't even get so sort of, and that is how we should be looking at it, that if should you get severe COVID-19 disease, the possibility of is there, and also the possibility of your family members who you come in contact with of dying is there. And therefore, as we said, when the scientists using the laboratory measures noted that there was an increase in the incidences of COVID-19 infection, then movement restrictions is one of the ways of trying to minimize the spread of this. So as was put, they say this place has the highest number of COVID-19 cases, so let's minimize them. And as we know, with COVID-19, you want about 2 weeks. If you contain those in 2 weeks, then you can now start seeing how to open it up you're hoping that in the disease has literally died down. So that's the basis of the curfews and movement restrictions. Of course, the night curfews are one way of just preventing prolonged meetings, especially towards the early morning when the parties become very nice, so to speak.
I'm happy you know that parties are nice in the morning.
Like possibilities of
Mhm.
transmission, they say that. That said, though, we may actually need to institute a study to see whether
Yeah.
these curfews and movement restrictions are
Mm.
beneficial. You know, when you have real data,
Yes,
then
with exactly, not just assumptions. Mhm.
yeah. So we are talking from there and saying, yeah, people think that they reduce the
Mm.
transmission, but may also want to do that real data vis-a-vis now what is called looking for incomes and running businesses
Yeah.
and also it's almost like you're weighing one against the other.
Okay.
Ideally, if today the all the vulnerable groups got vaccinated, for instance, then you'd say you've done something to actually try to mitigate, and therefore you try to open up a bit more. So actually, the way I look at it is that we should actually have the government looking at how to vaccinate as many people as possible so
Mm.
that we prevent severe disease, so to speak. So
Yeah. Yeah.
that would be my approach. If
Okay. Perfect. So, in getting the vaccine, it's not saying you're now immune, you're safe, you can do whatever you want to. It still means that you are still susceptible. You can still be infected, but you're not going to get the severe case of the disease, right?
Yeah, so vaccination is meant to prevent the vaccinated individual from getting severe disease. Severe disease is what
Mm.
is taking up all the health resources. And if you minimize the number of people getting severe disease, then you open up the health resources to treatment of all the other diseases and prevent what is called the secondary death from not having services available due to them
Mm.
being taken up by severe COVID-19.
Mm.
And therefore, that is the aim of vaccination. Just like all other illnesses that are vaccinated against, you may get the illness, but it won't be the severe illness that will lead to death and
Mhm.
there or hospitalization, so to speak. And therefore, that
Mm.
is usually the aim of vaccination.
Okay, all right. Um, in closing, I'd like us to talk about pregnancy and COVID. And I know, maternal health is very special to you because that is where you find yourself every day. That is what you help a lot of mothers, especially with delivery. And it's a very special and important branch of medicine. Talking about this virus and women who are expecting children, is it recommended that mothers get this vaccine?
So Kenya Medical Association has been doing what are called trainings and webinars on COVID-related issues. And recently, I think I recorded a video on the reproductive maternal health policy that has been put in place by the government, and I will send it to you then so that you can circulate and see. But when it comes to vaccination, then the people who are vaccinated generally are people on whom a study has been done. And
Mhm.
generally, when you are doing studies, the phase one, phase two, phase three, generally pregnant women are not included in the studies, and therefore we do not know
Right.
what its effects are on pregnancy. Recently, the Center of Diseases, CDC in America, has given a recommendation of vaccinating women where
Mm.
the benefits outweigh the, the dangers. And what does that mean? So we are saying if you are in a place where you are more likely to die from COVID than die from than high chances of contracting severe COVID, then vaccination may be useful in pregnant women. So the debate goes on, and we have also had a study or two that has come out that has shown that vaccinated pregnant women do pass the antibodies to their children. So so currently what we are saying is that if people are expectant, then first in our guidelines, we have recommended that they be prevented from being in a situation where they are likely to contract COVID and because they are susceptible. Pregnancy is what is called an immunosuppressive state. So your immunity may be lower and therefore more susceptible to severe COVID, so to speak. So avoid the COVID all the way. Pregnant breastfeeding women can actually be vaccinated because some studies have been done in adults. So that is that. So there is that benefit versus dangers debate, but places where pregnant women have been vaccinated and the outcomes have been good.
Okay. In closing, I've got one final question, and this one touches on long haulers, long COVID. A lot of people still walk around and say, COVID ni homa kali, shikwa utapona, you move on with your life. But then we're now beginning to see more and more reports of people who, for the past year, have actually just not been the same. They picked up the virus, they went through it, and instead of recovering, they still have recurring bouts of all kinds of things. It could be symptoms that flare up again. Let's talk about long COVID and understanding what it is and whether there are any studies in place right now in Kenya concerning that.
I'm impressed. I can see you've been reading around.
No, this thing is not a joke, Doc.
I'm very impressed, and that is good. And actually, what we are saying, that is the essence of science. COVID has a lot of unknowns, so we are actually collecting data on people who may have gotten COVID, and the data is now becoming increasingly available because more and more people are now reporting exactly what you are seeing, and we want to see whether these reported incidences are related to the COVID. They may or they may not be, but it is possible because people may have suffered from COVID, and so when some people have reported, maybe, hey, Daktari, I'm beginning to forget more. So we are asking, did the COVID have an effect on the brain or not? Some people are having, I'm actually recovering less slowly. I'm less able to walk or run as long as I be. So you want to see, has the COVID affected the lungs, for instance, and maybe replace the tissues with something that is not lung tissue, and therefore making tolerance to exercise less. And there's also the aspect of and recently we as Kenya Medical Association had the webinar on oxygen. So we are saying sometimes high treatment with high amounts of oxygen could also lead to some form of damage on the lungs. And so is it a result of the treatment, for instance, with oxygen, that leads to long-term effects? So all these things are being studied, and long haul COVID is actually a topic on its own, and we will explore it in the near future.
Yes, subsequent conversations, we really must talk about it, because then there's also something I had seen about that long haul syndrome, which also touches on mental health, anxiety, and depression. Yeah, we have a lot to talk about, Daktari. But I'm glad you're doing good. When do you get your next shot?
April 30th.
Oh, so almost. And then we'll touch base with you and see how you're feeling and walk that journey with you again.
We will, but we must remind everyone to wear masks where relevant, to wash your hands with soap and water, use sanitizer when necessary, and get tested if you feel unwell, and also see your doctor. And we pray that in the near future we will get better.
Yes, we do. Thank you so much for the chat. As always, it's great to catch up with you. My regards to your family and to the whole team at KMA. You guys are doing a good job. I follow and see what you guys are up to, but I wish you well. And once again, thank you for watching this channel, for being on this channel and watching this episode. Please drop a comment in the comment section below and share this video as well. It's all about sharing the knowledge and information that we get so that it can help someone who's got questions and may not know who to ask and where to look for that help. So thank you for checking us out. Please catch up with us again next week for another episode. Click subscribe, hit notifications if you haven't already. And till we kutana tena, live out loud and be safe in all that you do. Bye for now.
Bye.
Bye, dog.